You can see here there's some hard exudates, and this is very important point because I need to emphasize on that one. When we can see even the image, all these hard exudates are starting to disappear, and now they disappear totally with monthly injection, and now this patient is on 3 months interval, and I'm planning to extend it even further to 16 weeks to 4-month interval. The stability is excellent, but the key point, in my opinion, is to detect the patient early, treat strongly, and do not stop the monthly injection until you reach the maximum vision and maximum drying effect. Aflibercept has a well-established safety profile, and this is very important across all indications, supported by real-world pharmacovigilance monitoring. Aflibercept has over 4.8 million patient years of exposure and more than 34 million vials. I think we can reach now, as we have seen in the previous slide, 55 or 53 million vials have been sold. Since launch, the rate of IUI with aflibercept in routine clinical practice has remained low as 0.01%. The rate of endophthalmitis with aflibercept in routine clinical practice has remained 0.0007%, 0.7 cases in 10,000 injections. The post-marketing reporting of ocular retinal vasculitis after aflibercept is, I would not count the O's, it's almost 4 after the point. 7 cases overall in more than 34 million vials sold. So the safety, there was no safety signals whatsoever with aflibercept up till date. That's giving us actually great safety signal for aflibercept to give it for all our patients. With that, I think Ahmed will talk about the future.
I think, yes, let's finish the journey first because of the time, so we can have a few time for a question if you have time. So just 2 minutes to show you what's the future with the aflibercept. I think, I don't know if somebody knows about it, we are now talking about the new 8... Not from here? Okay, so we have now the, coming soon, the 8 milligram concentration of aflibercept. We have 3 main trials, 2 trials for with AMD and 1 trial for the DME. The phase 2 trial, which is Candela for AMD, and the other one, Balser, for the phase 3 trial for AMD. And for the DME is Photon trial. So this is still getting approval soon, expecting next year, I believe. The good thing here, or the idea here, as you know now, the new trend in anti-VEGF nowadays is the longer durability. So we need, as Ahmed was explaining, that we can extend the 2 milligrams. So if you have higher concentration, I think it can last longer. So the idea behind this is to find a way to have a longer durability molecule. So they compare the 8 milligram of aflibercept versus 2 milligram. And they give 3 loading dose monthly, and then they extend some patient to 12 weeks and the other for 16 weeks. It depends on the activity. So this is the new thing about, or the future about that. So we are waiting for the result and the approval. And I think let's wait and see about the result. But I believe it will be another player in the market with longer durability. I think, Ahmed, you already attended something in AO about the Photon trial. I think any release of data, you attend there or no?
Yeah. Yes, I think they just shown the data for the 2 years, I think, for the Candela study. And this have shown that we reach almost 16 weeks in about above 80%, if I'm not wrong. But we have here as well one point that we need to emphasize as well, because sometimes when we are increasing the drug, so this has any safety alarm for you, Ahmed?
I think could be yes, but as you mentioned, we need to study that because there is usually a thought that the higher the concentration, the more likely to have side effects, either systemically or intra or ocular. So it's very important to study those side effects. I believe in those study there will be a safety profile also at the end when the result came out. But I think this study originally only showed that the safety, our initial 16-week, it was not too much high. There is no allergy. There is no case of vasculitis or any endophthalmitis like that. But we're still waiting for the final result with the final approval, and we will see the whole result in deep detail. So I think we are done. If you have any question, we can open the floor for question. Any question from anyone who want to ask anything? Nothing. So let's just one quick question, Ahmed, because you've seen very interesting cases. So in your hands, what is the maximum? I know you are following treat and extend protocol after stabilizing the case, either DME or AMD, but in your hand with aflibercept, what is the longest period you can extend in your life?
Almost now, I'm using the aflibercept since 8 years since its launch. In UAE since 2014. So I have patients who are extended up to even 6 months without any activity whatsoever for CNV and for DME. Those are, I would say, not few, but in my practice, I would say 30 to 40% of my patients.
You can extend.
Old patients, yes. And some of the patients that I've just shown, they are extended easily till 4 months.
4 months. Yeah. Okay, that's good. Great. Yeah. Regarding
some, they need still injections on monthly basis. So I would not take this as if all the patients are moving to 4 months interval. Some patients are needing the drug every month. That's why we are having even the 8 milligram. We hope with that it will push those patients, those category of patients who are dependent on the VEGF, anti-VEGF drug on monthly basis or every 2 months, to extend them, to be able to push them further to 3 months or 4 months, especially in those category of patients.
Yeah, I think because not all the patients the same, because you have some resistant cases that does not last longer, but if you have a patient that's compliant, you treat him early. I think with those patients you can reach further time.
Yes.
And we are waiting also for the new 8 mg to see the results. One more thing regarding the consensus. I think he was part of the board that involved in the with ISO to make a consensus or treatment guidelines in UAE. So any comment from your side about the anti-VEGF want to use and any something?
We both was part of this very great initiative to have a consensus for DME and UAE. And I think we all agreed that the treatment of choice or the first line treatment is anti-VEGF. And seeing as well the other guidelines like the EU retina with patients with worse visual acuity, less than 69 letter, Eylea have shown better result and better improvement in visual acuity. So for those patients, that's my choice. And usually with the consensus, we hope that we gave a foundation for the treatment protocol for all users. So we did not specify which one that we be able to use.
Yes,
yeah, we did not want to limit our guidelines. So we have now the 2 milligram. Later on, we'll have the 8 milligram for Eylea. We have other drugs that are working as well. But in my hand, I would definitely prefer to use what is the most potent for my patients to give him the best result, moving on from the first injection.
Okay, thank you so much. I think we are almost at time, or we still have time, or we are out of something. Yeah, please. Yeah.
Thank you for both of you. This was a very nice presentation, Ahmed. I think what you said about extension is very important because we always need to get the patient off the hook of frequent injections. But my experience, when I want to extend like 4, 6 months, I have some patients who are extended up to 6 and 8 months. But those patients, I did not extend before the 3rd or the 4th year of treatment. So just to, and they are probably in the older age group. Do you have the same experience, Ahmed, or do you tend to extend earlier? Long extension, I mean.
Long extension is, I think the pivotal issue about it is to make sure that your patient is compliant, and whenever there is any issue, he will come earlier to be treated, because we do not want to have a relapse or to start the treatment once again. And maintaining that is depending on the frequent injections started early, and then seeing the extension. We do not jump into 4 months. I usually move into 6 weeks, then 8 weeks, so 1.5 months, then 2 months, then extending to 3 months, and keep him on 3 months. Then if everything is stable, that's the time I will extend to 4 months. And after this, if everything is stable for 4 months for repeated injections, that's the time I would say let's move on even further, but I will still see you after 4 months. If everything is stable, I will extend a little bit further to reach to 6 months. These are few patients, but they are doing well. We have now AI that will help as well to detect those patients and any relapse. We have a module which is called All Eye. This is an app over the mobile that those patients, when I have actually patients traveling from outside of the country, they use the app and see if there is any change, and they ask to come earlier to get the treatment.
Thank you, Ahmed. This is what I wanted to stress. If you want to extend, don't be hasty. You take your time. My experience, I did not experience this before the 3rd or 4th year of treatment. The patient should be compliant, and you have to keep an eye on them. Thank you. It can happen, you know. I have few patients that I extend them up to 6 and 8 months.
But
Thank
definitely
you,
not in the first year. I agree with you. Yes, first year we need to avoid the under treatment. I think I can hear the ring now ringing. So we still. I think. Thank you so much.
Thank you all for attending.
And we hope to see you next year, inshallah. Thank you.
Thanks.
Thank you, Ahmed.
Thank you very much.